Hello and good morning to you students. We have a new president. Or do we? I would like to begin by recalling that our electoral college system elects our president. So while the major media outlets have announced that President-elect Joe Biden has received enough electoral votes to solidify the presidency, Donald Trump has until December 1st to make any legal action that he has claimed to make before the electoral ballots are counted at state legislatures. So while it has been projected that the president-elect will be Joe Biden, and there's really no reason to believe otherwise, technically there is until December 1st before that action is made congressionally official. Does that mean that there's a chance he won't be president? I mean, yes, although it is extremely unlikely, unless some legal action that the president tends to take proves fruitful for them. But for right now, there's no reason to believe that that would change. Okay, so, boom, social policy. There's a whole bunch of information about social policy, and this is one of our most contentious topics, so I'm going to give you guys just the bare facts and let you decide on your own about how our social policy is run in the United States. But first, talking about public policy in general, you have to understand how policy is made. It has a four-phase process. First is setting the agenda, which is bringing attention to the issue or bringing public attention about the issue to the forefront, creating or focus on the problem, and that's going to be followed by formulation in which the policymakers take up that issue and maybe create some sort of strategy to address the problem. That's going to be followed by implementation or adoption. Those are the exact same things when they actually formulate and adopt a policy solution, usually by way of a regulation or a law. And then policy evaluation is when the government agencies are given the responsibility to make the policy work, and usually in the form of regulation, guidance documents, grants and aids, making sure it happens. Evaluation is going to see whether or not they had the opportunity, or whether or not that policy or action actually resolved the issue. Analysts inside and outside the government will determine whether or not the policy is addressing the problem in a way that is meaningful and that minimizes fraud, waste, and abuse. Okay, also some terms that we need to be familiar with moving forward is the term goods. In a capitalist economy, which we have in the United States, you have to describe the commodities, services, and systems that we use to satisfy our needs as goods. So that term goods is going to talk about the range of things that we use to satisfy our wants and needs. These can range from things like our food or our home, or things that are less tangible like our national security or our public transportation system. Okay, and they can be classified in two ways, public and private. Private goods can be owned by an individual and are excluded for use from others, typically because of price. For example, I own my home. Nobody else owns it, just me. I pay for it, and because I make the payments, nobody else is able to live here. Same thing if you rent an apartment. That is that one apartment that you pay rent for, which means nobody else can have it. It's a zero-sum game. When you own it, nobody else can own it. Okay? I own a book, or this is my phone that just rang, and it's my phone. It has a phone number for me. I paid for it, so it's mine. It is finite, and also it can run out. Okay, there is a finite number of iPhones in the world. Okay, and that's where supply and demand comes into play. But we're not going to talk about that right now. Public goods or collective goods, on the other hand, are not something that are finite. They are not excludable. Everyone has access to them, and they cannot be owned by an individual. For instance, I cannot own the air that I am breathing. I cannot own education or national security. These are things that are non-tangible and will not run out. Forests, water, fisheries are a type of public good that are common goods, but they may be considered finite. So they're part of collective goods in that we could all utilize them and nobody can technically own water, but it is a public good, however it's finite. So it's kind of a gray area. These public and collective goods we have a very difficult time legislating or regulating them because nobody has a financial interest in protecting their long or short or their long-term future value. We're a very here and now society. We're very interested in, for example, during the COVID crisis, rightfully so, which by the way still exists, we had public policy makers implementing legislation or mandates that said you cannot be removed from your house. Okay, you can't be foreclosed on. And that, I completely just lost my train of thought. Remembered it. Oh, so because there is an immediate here and now, we do not want our people to lose their home. They were able to pass immediate resolutions to ensure that people weren't evicted, rightfully so. However, because there's no tangible way to say we need to make sure to protect the clean air for posterity, for future generations, it's not as pressing for us and therefore much more difficult to get legislation passed in that way. Moving forward, we can classify our public policy in 3 different ways. Redistributive policies that shift resources from the haves to the have-nots. Distributive policies that are funded usually wholly or largely by the base of the taxpayer and address group needs, okay? And then regulatory policies restrict behavior of certain groups. Let's look at that. So redistributive policy helps the disadvantaged. It promotes public interest. Usually the person who benefits most from this are disadvantaged citizens. The people who pay for these benefits are going to be middle class and wealthy citizens, and their examples of these redistributive policies are going to be Medicaid, food security policies like TANF or food stamps, and health care. Okay? Distributive policies are meeting the needs of specific groups. Legislators and interest groups are usually going to be the ones who promote them, like AARP, for example, or a veteran organization. Who benefits are those specific groups: veterans, retired people. All taxpayers are going to pay for these because they're subsidies from the government, which means our tax dollars are paying for them. And examples of this are programs that help benefit veterans, or perhaps farming subsidies, middle-class mortgage holders. AARP would be like benefits for retired communities and elderly populations. And when I say things like other groups, students can be part of this group. So if you are on the Pell Grant, for example, would be an example of a distributive policy in which the entire government pays taxes, and that is distributed to a small group of people who use that particular benefit, the Pell Grant, which I'm actually betting is a large number of you. So I lost my place because I asked my husband a question. I think that I was on distributive policies, but if not, we're going to talk about it. An example of a distributive policy for veterans would be like the GI Bill. Those are veteran interest groups lobbying to get a specific distributive policy that benefits the veteran population at the expense of all taxpayers. I mean, for the most part, people don't have a problem with that because they feel as though the policy itself is benevolent. So regulatory policies, on the other hand, are going to be limiting or controlling the actions of individuals for the interest of the general public, and it's usually targeted at specific groups, things like environmental policy, food and drug, automobile safety, and usually it has a lot to do with waste. For example, if you're in an automobile industry, they tend to have a lot of toxic waste that they have to get rid of. That toxic waste could easily be gotten rid of in a less expensive but more unfriendly to the environment way. But a regulatory policy would mitigate that behavior, requiring that agency get rid of the toxic waste in a more expensive, less costly to the environment way. Another one would be regulatory policies from the Food and Drug Administration that would require certain kinds of behaviors when handling food and sanitary practices to prevent the spread of bacteria. Another regulatory policy, for example, from the CDC, would be to maintain social distancing guidelines so that we don't spread the coronavirus, or the use of masks as a mandate for people's behavior to reduce the spread of germs. Everybody wants to stay healthy. Okay, so now we're going to look at the historical context of our welfare state, or the social policies that deal specifically with a group of people who are more impoverished. The social safety net of the United States, which is kind of like the crux of our social policy. The government implementing these policies to help open opportunity for all. Okay, the idea of a welfare state is this concept by which the government plays a key role in the protection and promotion of economic and social well-being for its citizens. This did not come into play. Actually, I'm going to hold on to that statement for just a couple of slides. In our American social policy, we have 3 specific goals: to help people deal with life hazards when they are incapable of doing it on their own, okay, like staying out of poverty during old age. It's not our fault we got old and are unable to work, right? It just happens. And the government has to step in and ensure that just because you are old and unable to work, you still are able to have food and a home and essential things that are needed to live. Or short-term unemployment. For example, if there is this weird, crazy virus going around that shuts down the economy and forces massive layoffs, it's the government's responsibility to ensure that the citizens, through no fault of their own, who have been furloughed or unemployed, still have their basic commodities needed for living, like food and rent. Or being able to remain independent if you've become disabled. If you've been injured in some capacity, a work-related injury or non-work-related injury, you still should be able to have a certain level of individual autonomy. Rather than some places back in the 1500s where if you become disabled, they send you into an institution and you live there like an animal. I was hoping my husband would laugh, but he didn't. He still didn't laugh. I think he's not paying attention. He might not even be in the house. I wonder if I'm just talking to myself right now. All right, the second one is to promote equality of opportunity. Okay, this is going to be a primary means to a long-term economic benefit for which the entire society became more educated and employed, so that we don't have to rely heavily on a welfare state. If we invest in schools and housing and opportunities for all Americans, regardless of gender or ethnicity or religion or income, any of that, eventually we will have a society in which all people have the same opportunities to advance or gather, what's the word I'm trying to think of? Not gather, but accumulate wealth to a point where they no longer require assistance from the state, and our welfare state will gradually lessen. And then finally, alleviate poverty. Alleviating poverty is extremely vague, and it's controversial on both sides, because you have to ask yourself, what is the reason that people are in poverty? Are people in poverty because of lack of educational opportunities? Are people in poverty because they choose to be? Like, there's a lot of discussion around the reason people are in poverty. So until we can figure that out, it seems extremely unlikely that we're able to get something else. I don't know what just happened there, but let's see. Okay, moving on. So the history of the welfare state, like I was about to say a moment ago, social policy prior to the New Deal in 1935 was extremely limited to charities, local entities, and often the goal was to reform poor people. Make them self-sustaining in some capacity. And there was little attention paid to the systemic causes of that poverty, perhaps like health or lack of education in particular. And the programs distinguished between deserving and undeserving poor. So they were extremely discriminatory. They created programs to help the deserving poor. I'm putting that in parentheses or quotes, because deserving was not necessarily, the actual term that should have been used. Programs that aided deserving poor were like orphanages, schools for deaf and blind, mothers of widows with children, veterans pensions. But on the other hand, if you were poor because you were raped and you had a child, you were considered undeserving. Or if you had a drinking problem, you were considered undeserving. If you had a gambling problem, I mean, and there's just a lot of discriminatory practice in that. The first programs developed to benefit waves of European immigrants were designed to promote both health and good citizenship. And again, the assistance was extremely discriminatory. Black people found it nearly impossible to get assistance, as did Asian immigrants, as they were generally excluded in their entirety. The Great Depression hits, we know, in 1929, and national unemployment reaches 20%. And so charities and local entities couldn't manage on their own. In fact, the majority of states were bankrupt themselves. And so because of this, all of these able-bodied, intellectually able, skilled laborers did not have a job and they did not have money. And so the perception of what is deserving and what is undeserving has now dramatically shifted, okay? Because now we realize that sometimes there's things that are beyond our control that cause somebody to be in a situation that requires them have some sort of social safety net from the government. And so you would say that the welfare state founding was the inception of the Social Security Act of 1935. And the Social Security Act of 1935 created two separate categories of welfare: contributory programs and non-contributory programs. Contributory programs are those that are financed in whole or partly by taxes or other mandatory contributions. They tend to be more popular. They think that these people, citizens view them as earned benefits because they have paid into them. So if you're receive a paycheck, for example, you'll look at that paycheck and see that Social Security and Medicare have automatically been taken out of those. And so when you're old enough to receive Social Security and you're old enough to receive Medicare, you feel as though because you've paid into it your whole life, you deserve to get it back. Which, I mean, in reality, that's not kind of like a crazy thought. Hey, I paid into this program so that when I'm old, I'll be taken care of still. Social Security, however, has a lot of problems because now this was created in 1935, and there are significantly more people pulling out of the Social Security program than putting back into the Social Security benefit program. For every 2 people pulling money out of the Social Security pool, only 1 of citizens my age and y'all's age are putting in. So by the time that, hopefully not by the time that I'm 65, but certainly by the time that y'all are 65, and I say y'all, I mean like 18, 19-year-olds, turn 65 and are eligible to receive your Social Security benefits, if there is not some significant Social Security reform, that benefit will not be available to you because it would become bankrupt. So Social Security is old age insurance. It's funded by a payroll tax, and employee and employer each pay 6.2% of your earnings, up to $113,700. Okay, they are tied to contributions, which means that for every individual contributing money, an individual is pulling out. At the beginning of Social Security, more people were contributing than were receiving that benefit. Now, more people are receiving the benefit than are contributing. This is due to a number of factors. In particular, people are living significantly longer. Back when this was first incepted in 1935, they expected people to live off Social Security benefits for 5, maybe 10 years. Social Security benefits are able to be received at 65 years old. And in some exceptions, you can get it earlier. But now, the general age, people's median death is like 80. So people are living off of these Social Security benefits for 20, 30 years, which is problematic. It's a lot of money. And a lot of them are also double dipping, which means they get some sort of pension from retiring from a program or from their employer, and they get Social Security benefits. So a lot of people who are on Social Security actually don't necessarily need Social Security. Must be nice. Medicare is going to be another one. This was established in 1965, and it is a form of national health insurance for elderly and disabled people who don't have health insurance through their employer, nor do they have a pension that allows them to have health insurance after they have retired. Again, funded by payroll taxes. This is a 1.45% tax on all earnings. And they are equal for everyone. They're not tied to contributions, which means that for Social Security, for example, says that if you've only worked for 10 years of your life, you're only going to be able to receive a certain percentage of your contributions. But Medicare, once you are eligible for, you can get regardless. If you are eligible for Medicare for whatever reason at the age of 60 instead of 65, you get 100% of the benefit rather than a portion of it depending on how long you've contributed, like Social Security. Most of the expenses for these welfare state programs come from increases in Social Security and Medicare. So both programs are for the elderly. 57% of the federal budget is spent on these entitlement programs. Then there's non-contributory policies. These are benefits that are based on demonstrable need rather than an entitlement. So, for example, you have to, in order to receive this non-contributory program benefit, you have to prove that you need it, okay, via what's called a means test. You have to prove that you are under the federal poverty line for an individual or family to qualify for that benefit. The most important non-contributory program was Aid to Families with Dependent Children. That was replaced with TANF in 1996, Temporary Assistance for Needy Families. It was extremely unpopular among voters, elected officials, and those who do not need it because it costs taxpayer money. It's essentially programs that all taxpayers are paying into, but only people who are needy get. So if we go back a little bit here, it is a redistributive policy in which who pays? Wealthy and middle class largely, and disadvantaged citizens. This is a very much rob from the rich, give to the poor. Now, a lot of people feel as though this is part of what, if you are in a society in which you have the means to help, you should. Other people are saying, hey, that's my money. I don't want to give it to people for whatever reason. So there have been significant amounts of reform since 1996. There's been a number of changes because there is such thing as fraud, waste, and abuse when it comes to the welfare state. There are people who abuse the welfare system so that for whatever reason they can get the benefits without having to actually prove means. But in the next couple of slides, you'll see that that's not the vast majority of it. In 1996, we implemented a number of reform changes. For example, there is a 5-year lifetime limit on these benefits, and you cannot receive these benefits for more than 2 years at a time. You can require, some of these benefits require work or education training, and there can be punitive penalties if, for example, your children are skipping school. So if your child skips school, regardless of the reason that they're skipping school, and your welfare finds out about it, there could be a punitive loss in benefits. There's significantly less cash assistance. 70% of TANF funds are not cash payments to the recipient. They are paid by way of reductions in subsidies for their bills in some capacity. So let's move on to Medicaid, not Medicare, which Medicare is a entitlement program that you get upon the age of 65. In some other cases, it could be earlier, and it is a contributive policy. You pay into it. The federal government and state government both finance Medicaid, though it is a state-operated program to provide medical insurance to low-income people. It is means tested, which means you have to apply and demonstrate a need for that program. And payments to healthcare providers are lower than they would receive from other insurances. And so that means that doctors and hospitals do not necessarily have to take Medicaid patients because this is a much larger conversation, but it essentially means that if you are low income and require Medicaid, there are providers, doctors, and hospitals that may not accept your insurance, your Medicaid insurance, because the payout from Medicaid is lower than it would be from a private insurance agency. And that's all I'm going to say about that. Except for that sucks. And the whole point is to open opportunity. Additional programs and policies have been designed to promote equality of opportunity, not actual equality of outcome. Okay, equality of opportunity, not equality of outcome. And this is like education, health, employment, and especially housing opportunity, allowing people to have the opportunity to purchase their own home, which is one of the American dreams. This whole path to economic prosperity grew out of the Depression era focus that targeted largely on the growing systemic causes of poverty. So we have a lot of funds they support not entirely costs for the efforts to create a economically prosperous environment that focuses on promotion of equality of opportunity. And there's been a lot of housing policies that promote equality of housing for lower income families. They spend a lot of focus on promoting home ownership, but not necessarily housing for the poor. We do have a federal agency that is associated with that. That's called the Housing and Urban Developments. It's headed by Ben Carson. Some of these policies that help promote home ownership are things like providing low down payments, which is perhaps if you don't qualify for any other home ownership program, a federal home ownership program would say that you only need to put down 3% of the total home cost in order to secure a loan for that home. Now, if you're getting a $300,000 home, if you do the math on what 3% of $300,000 is, that's still a significant amount of money. There's generous repayment terms, which means you have the most common are 15 and 30-year mortgages, which means you have either 15 years or 30 years, and the vast majority of people pay 30-year plus repayment plans. Favorable interest rates. Right now the interest rate is extremely low. It's at like 3.25%. Again, 3.25% of $300,000 over 30 years is an awful lot of money. So if you guys ever want like home ownership advice, I would definitely talk to somebody at like a bank or some accounting firm before you take advantage of these policies, because while it is good for some people, it may not be beneficial for others. There is a home mortgage interest tax deduction, so you can deduct the amount of taxes that you pay, or deduct how much you paid in taxes from your overall federal income tax. That's helpful. And then there's also Section 8 housing vouchers that give discounted rents to certain housing projects throughout the nation. Education is going to be providing education to provide a workforce with a solid foundation of skills and knowledge, things like vocational training. Traditionally, these are funded by states and local districts, although the federal government does still spend billions on education. However, they still only fund about 6% of local independent school districts, especially here in Texas. There's tons of higher education benefits, financial aid from the federal government for higher education, research grants, and programs that support K through 12. Employment, have goals of employment training and retention programs, how to prepare and then retain workers to fill openings. And these programs are funded by the United States at a significantly lower rate relative to how they spend on education. There are health institutes that have health initiatives to try and keep a healthy electorate. Health-related institutions provide benefits and grants to support medical research like the National Institute of Health, the CDC, the FDA, and they are to ensure sanitary conditions and equality in terms of receipt of that good. There are things in the United States called food deserts in which the FDA and other institutes like the National Institute of Health attempt actively to try and eradicate food deserts, which means they don't have access to fresh food. Fresh food meaning like fresh produce, fresh meats, within a certain mile radius. Public health in the United States isn't great. 2013, the World Health Organization ranked the United States as the 37th world's healthiest system. Many administrations since FDR have attempted a major healthcare reform, and these include Kennedy, Truman, LBJ Nixon, and Clinton. It wasn't until Obama put forth the Patient Protection and Affordable Health Care Act, the ACA, or Obamacare, that we actually created a national healthcare system that covers Americans without some private insurance. And it's based on three components. State-based insurance exchanges, in that they can't deny you coverage based on pre-existing conditions, which is awesome because a pre-existing condition can range anywhere from pregnancy to mental health issues, to like a injury that you had when you were a child. Those could be reasons that prior to the Affordable Care Act, insurance companies could deny you coverage. That sucks. It requires uninsured to purchase health insurance, called the individual mandate. This has recently been struck down. That is no longer an issue. It does not say that if you don't have health insurance, you have to purchase it. It does encourage you to, because it is, you don't want to be stuck with large hospital bills, and you want to be able to go to the doctor if you're sick, because a healthy individual helps a healthy society. But this individual mandate is no longer part of the Affordable Care Act. And it provides subsidies for small businesses and low-income people so that they could afford health insurance or afford to provide health insurance. This has been fully implemented. Well, it would have been fully implemented if it wasn't for the Trump administration that is currently advancing it to the Supreme Court to determine its constitutionality. More to be seen on that. And it's based on the Massachusetts model proposed by Mitt Romney. Other states have implemented their own healthcare reform, like Hawaii. So let's talk about who gets what. We're almost done here. The elderly and the middle class receive far more in these benefits per person than do the poor or the children. Groups of social policy, public, unemployed, poor, minority, children. Groups in social policy, there are different groups. Unemployed, poor, minorities, women, and children. Of these, elderly and middle class receive far more. Here's a breakdown. The elderly, in terms of Social Security and Medicare, in 1959, 35% of elderly were considered poor or living under the poverty line. In 2008, only 9.7% were considered poor. So, Medicare is good. Hey, yo. So why are Medicare and Social Security programs so popular? Because, again, they're contributory. We have paid into these programs, so people want that benefit once they're eligible to receive it. Hell, I do, and I've only been paying into it for the last 20 years. That's a long time still. It also reminds me of how old I am. That gives me some anxiety. They're seen as deserving, which means that you deserve to get health insurance when you no longer have to work because you've reached the age of Social Security, when you've retired. Elderly people in the age bracket above 65, or the boomer generation, are the largest voter turnout base. So they vote. They vote a lot. However, they are not the largest demographic anymore. Millennials and Gen Zers are going to be the largest group of voters. But y'all don't go vote as much as old people do. It's because they're bored. But don't order for the table if you're about to leave the restaurant. So you guys gotta go and vote. And AARP, the Association for the Advancement of Retired People, is very big. The middle class. Elderly can receive benefits from the government even if their children can afford to pay for the benefit on the private market. So let me say, for instance, my parents are getting to that age where they're able to get Social Security. Both of them can receive a pension. Both of them are able to live off a retirement, a private retirement fund that they've created themselves. And I suppose, if necessary, their children, me and my brother, would be able to pay for the benefits, or health care and Social Security benefits on our own for them. In other nations, like Asian nations and European nations, there's a more cultural influence about securing these benefits for your elderly. They take a lot better care of their elderly. Over here, we're like, bye, Mom. See you later. There is something called a shadow welfare state, in which tax expenditures from employer-provided benefits and deductions make people look as though they're living under the poverty line, but in actuality, it's just the deductions. So the working poor exists, and a big group of people exist under the working poor category. In fact, most of you guys probably are considered working poor. They earn too much to qualify for welfare programs, but they don't earn enough to have benefits like owning a home. They have a job, but that job provides limited, if any, kind of benefit like health insurance or retirement plans, and sometimes those health care benefits are too expensive to afford. They could even hold several part-time jobs, and most often don't have access to those benefits. They do have two policy programs that exist to help that. Food stamps, the Supplemental Nutrition Assistance Program, SNAP, and the Earned Income Tax Credit. Both of those programs may apply to you if you find that you are one of the people who could classify to be working poor. There are still also some non-working poor and still some working poor. Again, TANF, SNAP, Medicaid, and programs that are typically aimed to help children. So many working poor earn very little, still qualify for those above mentioned benefits. And when we define poverty and defining living under the poverty line based on the 2010 census, we don't have the 2020 census information yet, but it is defined as one parent with two children and an annual income of under $18,000, or two parents and two children with an annual income under $22,000 is considered under the poverty line. The 2010 census, poverty by household, 32% of single mother households live in poverty, 16% of single father households live in poverty, while 6% of all two adult households live in poverty. 22% of American children are poor. Poverty rates by race and ethnicity: 10% of whites are poor, 12% of Asian Americans, 27% of Latinos, 27% of African Americans are considered poor. Almost half of the world, over 3 billion people in the United States, live on less than $2. I'm sorry, not in the United States, but in the world, live on less than $2.50 a day, and 2.6 billion in the world lack basic sanitation. There are international organizations that exist to help eradicate that problem. Things like the Organization of American States, the World Bank, the United Nations. Some of their global sustainable programs are to eradicate poverty around the world.